Are you ready to do some tracings? Before we get started, you should have memorized the major blood vessels that are on the wall chart in the audio tutorial lab. Make sure you know all those major vessels, and that will make tracing much easier. Now, if you think you're going to memorize all of these tracings, that's the wrong way to go about it. What you need to do is understand the pathway, and then it makes it easier. Many of them are alternate versions of the same pathway. So let's get started. You know, anytime we go to a tissue, it's at a capillary bed. In order to get into a capillary bed, we have to go through a small vessel called an arterial, and then you go into the capillaries, and then you exit that tissue by small veins called venules before you go back into the vein. So we represent tissue by ACV. That's little ACV. All lowercase letters because they're small. ACV. Now if you're already in a organ, then you start at the capillary bed of that organ and leave through a venule. So that would be CV. If you're arriving at an organ, you would start at an arterial and you would go into the capillary bed. So that would be AC. So it depends on whether you're going through an organ or whether you're starting in an organ or whether you're going to an organ as to what actually you will talk about in the tracing. So let's start with the first tracing. This one is kidney to kidney via the left myocardium. Of course, if I had it just kidney to kidney, it would be a pretty easy tracing. But what I want you to do in this tracing is understand how the left myocardium, that is the muscle of the heart, actually gets its oxygen supply or its blood supply. So notice that we're starting in the kidney. We're already in the kidney, so we're in a capillary bed. That would be CV, so capillary bed to a venule, and that would be CV. And then we exit the kidney through the renal vein. That goes into the inferior vena cava. You then enter the heart. You remember where you enter the heart at? Yep, the right atrium. And you go through the heart tracing. Now this is where you would stop and ask the instructor if they want you to trace the heart. We may say yes, we may say no. You may have already done it already by looking at the models or in some other fashion, and we might have you just skip that part. On the other hand, we could have you do the heart tracing as a part of every tracing that has the heart in it. You then leave the heart through the ascending aorta, the left coronary artery, and then you go to the circumflex artery. Now if you want to know how you get into the left coronary artery or into the left circumflex or just the circumflex artery, because there isn't a right one, you could look in your textbook on page 661 and find out where those arteries come off of the ascending aorta and onto the heart, onto the left side of the heart. Now you're in the left myocardium and you're going to go through that myocardium, so you're going to go through an arterial, a capillary, and venules, an ACV, all lowercase letter. How do you exit the myocardium? Well, you go to the great cardiac vein, and then that goes into the coronary sinus, which actually goes back into the heart again. So this one would have two heart tracings because we want to go back to the kidney. And of course we're not going to ask both of those heart tracings, or will we? Yeah, we could. So you go through the ascending aorta, the aortic arch, the descending aorta, the renal artery, and then to the kidney. And that's tracing number one. Tracing number two is an interesting and an important one. Let's start at an IV injection, an intravenous injection. That's going to be on the left side. Not always does it have to be on the left side, but we're going to start on the left side. So we're going to go from the left IV injection at the cubital fossa. Remember what the cubital fossa was? Yeah, that dent in the front of your arm. So we want to then end up and see how that injection, whatever we might be injecting there, would get into the brain at a part that we call the right cerebral circle, which is in the middle of the brain. So in this one, the injection would go into the left median cubital vein. From there it goes to the left basilic vein. you might think that it would go into the radial vein, but this is a superficial injection, and the basilic vein is more superficial. So you go into the left basilic vein, into the left axillary vein in the armpit region, into the left subclavian vein, so we're going back up, the left brachiocephalic vein, and then into the superior vena cava. This is where we enter the heart. We have the heart tracing, and then exiting the heart we have the ascending aorta, the aortic arch, the brachiocephalic artery, the right subclavian artery, and here is where we go into the right vertebral artery. This artery is not pictured on very many of the diagrams, but you can find it. There's at least one good diagram that shows where the right vertebral artery will come off of the diagram off of the subclavian. The vertebral artery goes through the transverse foramen of the cervical vertebra. Remember those holes in the vertebra of the cervical vertebra? That's where the vertebral artery goes. And then you go to the right posterior cerebral artery and into the right posterior communicating artery, which is part of the cerebral circle. And that's tracing number 2. In tracing number 3, let's start at the spleen and then end up back in the spleen. So since we're already in the spleen, we would leave it from the capillary beds through the venules. So that would be thus little CV. We go into the splenic vein, the hepatic portal vein, and that leads to the liver, which is venules, capillaries, and venules. Because you're already in a vein, you don't go through an arterial capillary venule. You actually go through a venule. You leave a small vein and go into a venule, and then to the capillary bed of the liver, and then you exit through another venule. So that one's VCV instead of ACV. If you don't understand this, get some help from an instructor. You leave the liver through the hepatic vein. That goes into the inferior vena cava, where you then would enter the heart tracing. You go through the ascending aorta, the aortic arch, the descending aorta, and then, let's see, how do you get to the spleen? Oh yeah, that's right. You have to go through that small branch called the celiac trunk. Celiac trunk is also known as the celiac artery. The celiac artery leads in a number of directions, 3 main places, and one of those places that it leads to is to the spleen. So you would go into the splenic artery, and then you would enter the spleen, and you would go through an arterial and then into a capillary bed to get into the spleen. And that's tracing number 3. In tracing number 4, we're going to start at the renal artery, go through the kidney, and end up back in the hepatic portal vein. So let's start at the renal artery. We're going to go into the kidney, arterioles, capillaries, and venules, ACV. We exit the kidney in the renal vein. We go to which goes to the inferior vena cava, which goes to the heart. We do the heart tracing, and then we go into the ascending aorta and the aortic arch. Let's see, where we're going? Oh yeah, we're going to the hepatic portal vein. Let's see, how do we get there? Well, let's go through the descending aorta, to the celiac trunk again, and down into the splenic artery, going to the spleen. So you can see how this one is a version of number 3. We go through the arterioles and capillaries and venules of the spleen. We then leave the splenic vein and we go to the hepatic portal vein. There are several other routes that you could go. You could go to the stomach, or you could go to the intestines. You could choose. This one's one of the easier ones. And that's tracing number 4. Okay, in tracing number 5, we're going to start in the spleen again, but we're going to go all the way down to the right anterior tibial artery, down in the tibia area of the lower leg. So we start at the spleen. We are in a capillary bed there. We leave the spleen through venules, so that's CV. We go into the splenic vein, which leads to the hepatic portal vein, and that goes to the liver via venules, capillaries, and venules, VCV. And then we leave the liver through the hepatic vein. We go to the inferior vena cava, and that leads to the heart. We do the heart tracing, and then we leave the heart through the ascending aorta, the aortic arch, the descending aorta, and then we're going all the way down to the legs. So we go into the right common iliac artery, the right external iliac artery, the right femoral artery, the right popliteal artery, and that ends up can branch into the right anterior tibial artery, and that's tracing number 5. In tracing number 6, we're going to start in the brain, and then we're going to end up in the right spermatic artery, that is in the gonad of the male. So let's start in the right superior sagittal sinus. So look on page 692 of your textbook, and you can find out where those vessels are. That leads to the right transverse sinus. These are all veins, by the way, so they're going to be traveling back towards the heart. And that branches into the right sigmoid sinus, which goes to the right internal jugular vein. That leads to the right subclavian vein, to the right brachiocephalic vein, and then the superior vena cava. That enters the heart, and we go through the heart tracing, and we go through the ascending, we leave the heart through the ascending aorta, we go through the aortic arch, the descending aorta, and the right gonadal artery or spermatic artery, or also known as the testicular artery, branches off of the descending aorta. So if we were going to go to the gonad of the female, that is to the ovary, we would do the same tracing, and it would be the right gonadal artery of the female or the right ovarian artery of the female. And that's tracing number 6. In tracing number 7, we're going to start in the last segment of the colon, that is the sigmoid colon. It's located on the left and center part of the lower body. And we're going to go to the right radial artery, that is to the right arm. So we're going to start in the sigmoid colon, capillaries and venules, and we're going to leave that through the left colic vein to the inferior mesenteric vein, and then that joins with the splenic vein before going into the hepatic portal vein. You go through the liver, and that's going to be venules, capillaries, venules, VCV, to the hepatic vein, and that enters the inferior vena cava, which goes back to the heart. We do the heart tracing. We leave the heart through the ascending aorta, go through the aortic arch, the brachiocephalic artery, the right subclavian artery, the right axillary artery, the right brachial artery, and then we end up in the right radial artery. And that's tracing number 7. In tracing number 8, we're going to start in the left arm and go to the right side of the heart. But we're going to go there via the diaphragm. So we're going to start in the left brachial vein, which leads to the left axillary vein coming up the arm, to the left subclavian vein, to the left brachiocephalic vein,